Hi, it's Bill, the knee pain guru. Today we're going to talk about, so you've had your knee pain diagnosis. Now what? All that happens after the doctor finally tells you what's going on with your knee. We're going to address that in just a bit. We'll be answering questions after my short presentation. So if you have any questions, comments about your knees, knee pain, your diagnosis, whatever you're dealing with, please enter those in the comments section over on the side, and I will address those in a little bit. I also use those on future videos as topics for videos just like this. Make sure to like the video, give it a thumbs up, like and subscribe to my channel, The Knee Pain Guru, as well as turn on notifications so you are aware of future videos that I'll be doing on the different topics that you're entering in the questions for on the side. So it all works out great. So now we're going to get into, you got your knee pain diagnosis, now what? There's this moment, and I experienced that myself, when Dr. Ellis looked at me on the examination table and said, Bill, you tore the ligament in your left knee. We could do an MRI. However, it'd be a waste of money. There was that moment of truth, moment of like, oh, geez, this is really what I'm dealing with. I'd ignored it for 5 months. I dislocated my left knee 4 times, and I was in this space where I didn't want to really know what was going on with my knee. And at the same time, I wanted to know what was going on with my knee. So it was a strange place. And when the doctor gives you the diagnosis, there's this reality that happens that is a little bit disconcerting. For me, there was a sense of shock and disbelief and overwhelm, like, oh, geez, what did I do to my knee? I'd never had a knee injury like that, where it was permanent, where something needed to be fixed. There was confusion, frustration, anger. You're sitting there one-on-one with the doctor. I was sitting there one-on-one with the doctor, and then all of a sudden it's like, now the reality of what I was dealing with my knee was right there in front of me. You have all these emotions that are swirling around. What do you do with them? Because you can make really, really bad decisions in that place, in a state of shock and overwhelm, confusion, frustration, anger. That's the reality of being human. So it's important to understand what's going on in our bodies. And that's not a really good place to make life-altering decisions. The decisions made in that space can have impacts for the rest of your life. So you really want to slow things down and figure out what to do with these and understand this happens. This just happens. No matter how much you think you got it taken care of and you could handle this in that space, it's important to understand this happens to everybody. And possible diagnosis you can get is a torn ligament, like I got. I had torn meniscus as well, so that could be another diagnosis. You can be diagnosed with arthritis. You could be diagnosed with bone on bone, and as well as you could be told by your doctor that you're a perfect candidate for a knee replacement surgery. Brain's going to go pretty fast in that space when you hear that information from the doctor. You could also get the diagnosis that there's nothing wrong. Your knee is normal, but you still have pain. So all of those situations and scenarios is going to bring up different emotions, different levels of confusion, frustration, anger, all of that across the board. The very first thing to do in that space is breathe. That's the first thing that happens when we hear information like that. We hold our breath. It's a normal, natural response to essentially experiencing an attack or experiencing some sort of trauma that is going on from the doctor that's giving us useful information. It's important that both of these things can be true at the same time. The doctor can be giving us useful information, and it can also be feeling like, oh, I'm being attacked and I'm being told things that I don't want to hear. So no, both of those things can be true at the same time. In that space, gather as much information as you can, which would include asking before you leave the office for a copy of the doctor's report. That's going to be valuable information for you to go back to your life and discuss it with your family, friends, loved ones. That's going to be very important information. So now you're breathing. You're getting the wits about you, knowing that this is information you don't want to hear, and get a copy of that diagnosis report so you can look at it later, because that's going to be very valuable. The doctor's going to be saying stuff. Well, we found, the inferior portion of your medial meniscus is intact, but then there's something else going on. They're going to give you a lot of anatomical and medical terms that aren't necessarily going to land and make sense. One, because you're hearing them for the very first time, and two, because you're in this state of, like, I'm in shock. Now what do I do with all of this? So get a copy of the report before you leave. The nurse on the way out is going to be able to do that for you, or the receptionist. And then you want to, and this is a difficult thing. I'm not saying this is easy, but try as much as possible to separate yourself from your situation, from the pain, because you need to have an objective perspective on what's happening. If you get all spun out and all emotional while you're in the doctor's office and you're making decisions from this emotional place, it's not going to be a good thing for anybody, especially you, because there's a good chance you can make the situation worse. So you want to try to separate yourself as much as possible from what's going on in your physical body. And then what's really important is make sure you have a friend, a family member, or someone you can trust that is able to make decisions on your behalf or bounce scenarios off of in terms of the different options that the doctor is giving to you. And this is not saying that you have to go down and do everything your doctor says. Remember, this is your body. This is your knee. And you can make decisions that empower yourself in terms of what avenue you want to go down, whether it be Western medicine, whether it be an alternative approach, or it be an integrated approach that incorporates what the doctor has to say and other therapies, modalities, support that you would get in conjunction with what the doctor is saying. However, you want to have that friend, that family member, or someone you can trust that has the same idea and mentality about healing the body. The reality of it is, not everybody looks at healing the very same way. There are some people that want drug shot surgery. That's it. Physical therapy, whatever the doctor says, and it goes. Nothing wrong with that. That's absolutely an option. And then there's other people that are all holistic and alternative, which will avoid knee surgery at all costs, will not want to take prescription drugs, will think, dealing with it on their own is the way to go. And then there is integrated approaches where that would be possibly, well, yes, I need a surgery to address this, but immediately I'm going to be doing homeopathics and herbs and other things to relieve the pain in my knee after the surgery. So you want to choose someone, the friend, the family member, the trusted person that is going to be like-minded, like you, that is going to have that same philosophy and approach that'll be able to walk you objectively through making the best decisions for what you choose to do with the situation with your knee. Now, does that solve what's going on with your knee? Probably not. But what we're doing here is we're setting up a foundation so you could move through this situation with your knee as quickly and as easily as possible. But I see so many people make mistakes over the past 11 years of doing this online is they don't set up that foundation to move forward, and they continue making bad mistake after bad mistake after bad mistake that puts them right back at the beginning again. And then they get stuck and they get frustrated and they're like, nothing works and nothing with my knee ever changes and there's nothing you can do and I've got arthritis and I'm getting old and that's just how it is. And what's important is that whenever we do anything, we build a house, we start a project, we have to start with a solid foundation. We have to have a game plan beforehand. And I know a lot of times knee injuries happen in an instant. And now we're thrown into this situation where we're wanting to get out of pain. We're trying to deal with the pain. We got the emotions and frustration that goes along with the experience of the pain in our bodies. You cannot avoid setting up this foundation in order to move forward, because you just end up, you're tripping yourself up. You're like, you want to get to that place out of pain, but you have this rope tied around your ankle. Then anytime you get to the end of that rope, it's going to jerk you back and you'll never get to that place. So I wanted to share that with you because this has been coming up a lot with those that are on my newsletter asking me the same questions over and over. And it's because they keep making bad decisions over and over because either they don't have enough information, they've not done enough research, they're not breathing, they're letting their mind spin out, and they don't have someone that's in alignment with them to support them through that process so they're not stuck in the same place over and over and over again. Okay, so that is, we got some questions here. Great. I'm going to get to those in just a second. If you like the video, give it a thumbs up, like and subscribe to my channel, as well as turn on notifications for future videos that I will be doing and presenting on similar topics for knee pain. Okay, knee pain. Marianne. Okay. Knee pain, was hit by a softball, swelling lower leg, not straight, circulation issues, try cortisone shots, but only temporary. Help. Yes. Okay. Head over to my website, take my 7-day knee pain reduction challenge. I will put a link in the description. That gives you my approach. My approach is going to be very different than doctors, physical therapists. My whole deal is, if we create comfort first, we start addressing the neurological patterning that's going on in the knee, causing the knee to hurt. So, Marianne, if you have circulation issues, the leg's not going straight, that's because when you got hit by the softball, what did the body do? Tensed up to protect itself. Normal, natural response to getting hit by a softball. Makes sense. This neurological patterning gets stuck in your knee, in your leg, in your body, and tells your knee it's not safe to move in a certain range of motion in this case. What ends up happening is the doctors with the cortisone shots are addressing it on a physical level to try to numb the pain so it possibly changes the neurological signaling, but not really. Because your body is still on a deeper level, is tensing up to protect itself from that experience of getting hit by the softball. If we begin to create comfort in the knee, in the leg, and not comfort in the general sense, comfort with intent and focus on the specific nerves and the range of motion, the intrinsic range of motion in the joint, that gets the pressure off of those specific nerves that tensed up when the softball hit it, what ends up happening is it starts to change the neurological signaling because the nervous system changes state from a fight or flight state when it got hit by the softball to a rested and relaxed state. The more we can do that initially, creating this intentional, focused, bringing awareness to how this pattern's going on in your knee, it changes the neurological signaling in the knee and the leg and the body, as well as in the brain, and then it lets go. So the circulation issues come back because now the body isn't so tense and afraid because of the experience of getting hit by the softball. That's my thing. That's the direction I would point you to get started. Let's see, Christine. Yep, bone on bone, torn meniscus in both knees, Baker cyst in the left and torn MCL on the right. Overwhelming is right. Great information. Thank you. I have complete knee replacement scheduled for 24th. It's horrifying to me. Not ready. Well, okay. Well, you don't have to do it, Christine. That's up to you. That's really is a choice. And sounds like you haven't been looking at or considering what I have to offer. So I'll leave that with you. You've heard my information. If you choose to go down that route with knee replacement surgeries, then that's your choice. And if you want to try an alternative and do something different to see about getting relief and getting results, to either one, postpone the knee replacement surgery so you don't have to get it, or avoid it because the only reason you go there is because you pain. So that's up to you. You can take the 7-day challenge and go with that. And let's see, what do you got here? What's your opinion on stem cell therapy? Stem cell therapy, I think, can be very valuable. It's a bigger conversation. Your body produces stem cells on its own. Like everybody's body produces stem cells. What ends up happening is we have such a high level of inflammation in our body that our body doesn't produce enough stem cells to be able to heal the joints. It isn't your joints aren't a priority. Your brain, your organs, your blood are the hierarchy. That's what keeps you alive. Anything shoulders down, hips down are not, doesn't keep you alive. So what ends up happening is the body has an innate wisdom, and it will move the stem cells that it does produce to the areas of the body that it needs to keep you alive. Brain, blood, organs. So now the stem cells that your body produces are just not enough. So you go pay lots of money to get a stem cell injection in an area of the knee to help it, but it's kind of like throwing a cup of water on a raging forest fire. We have to set up conditions in order to allow the body to have the resources to heal itself. Stem cells are great if you can afford them. And if you're changing the neurological patterning that's causing your joint to wear to begin with. So if you have a knee joint that's tight, that's been tearing the meniscus, that's been wearing and degenerating, because all diagnosis of arthritis and bone on bone is dehydrated joint. If you're sticking a needle in that place and the doctor doesn't hit a nerve and cause more pain, then you're also not having the room for those stem cells to really help what's going on in your knee because there's a lack of space to begin with. We have to address the tension patterns that are going on in the joint so the joint can begin to relax. You have more space. And if you choose to do the stem cells, it could begin to regenerate the joint. Now, if you want to do it naturally, we could begin changing the diet so you have an excess production of stem cells, and the stem cells aren't going to heal all of the inflammation systemically throughout your body, and it has the resources to be able to be directed towards the knees to begin healing the knees. Yeah. So the days when you feel pretty good, because Christine says, what's your opinion on stem cells? So I gave my opinion on stem cells. You have days when you feel good. And this is what happens with people with knee pain. Some days they feel good. Some days they don't feel so good. Some days it's pretty bad. Why is that? Because of the tension patterns of the body affected by a whole host of different factors: water, nutrition, breathing, mindset, your activity level, how much stress you have in your body. All of these can help. All of these can help or hinder how your body feels. Most of the time, people are going through their day and don't have an understanding of what factors are contributing to making their knees feel worse or better, if that makes sense. So my whole approach is, if we start beginning to intentionally create comfort in the knee joint, not just by happenstance, but intentionally creating comfort in the knee joint, we start changing the neurological signaling that's causing the knee to tense up to begin with, causing the pain. And we look at those other factors: water, nutrition, breathing, stretching, mobility, exercise. Bring that into the equation to begin to understand, with a baseline of comfort, which one is making it better or worse. And in all of that, you're teaching your body how to recover faster. Okay, Christine, let me know if that addresses your question. And thoughts on Rolfing, on helping the knee. Rolfing's great stuff, but okay, let me give you a background. I've probably had in excess of 50, 60 Rolfing sessions in my life. So Rolfing is very beneficial. The Rolfers that I have gone to will all tell you the goal of Rolfing is not to fix an issue. The goal of Rolfing is to get the body more in line with gravity, get the fascia more in line with gravity. And the more you get the fascia in line with gravity, the easier it is for the body to move. Now, this can be mutually, it can help with knee pain. However, the intent and the focus isn't necessarily to help with knee pain. Is that helpful, Ann? It's a good question. Understand, it's like they're almost mutually exclusive. You'll go to a Rolfer. Oh boy, it's hard to describe it. It's not necessarily the intent to get the body out of pain. However, in the process of getting the body more in alignment, it can get out of pain. And let me know if that addresses it. Okay, Nellie. I had a knee replacement a year ago, but I've just started having really bad pains in the knee and stiffness. Even the morphine doesn't seem to help. Nellie, have you talked to your doctor? That would be a thing to do. Knee replacements. Once you have a knee replacement, it opens up quite a can of worms. The worst scenario, and it's not to scare you, however, they are cutting off the bones in your leg and replacing it with plastic and metal. That's the reality of a knee replacement. The worst scenario that I heard was different scenarios where the joint wasn't fitted right. The screw started coming loose that they drilled down the length of the bone. That was causing a joint to be too loose. The worst case scenario, I heard someone contracted MRSA while they were in the knee replacement surgery. And within like a month after the knee replacement surgery, they were rushed to the emergency room and had to get their knee replacements removed. And they had to lay in a hospital bed for 5 months without knees. Now think about that one. So Nellie, what I would have you do is check with your doctor. Get your knees checked as to what's going on, so you know what you're dealing with. And exactly what I was this presentation, you'll want to watch the beginning of it in terms of breaking it down. You essentially need another diagnosis. You need to know from your doctor what is going on, so then you can understand what you're dealing with. Because if the pain is from something mechanically going on with the knee replacement, it's going to be different than if the pain, they just want to up your meds and get a new doctor. Like nobody. And this is one of the things that I get kind of feisty on, because you have this mutually dysfunctional, a lot of people, knee pain. And you'll learn if you listen to me long enough. I will say things not necessarily to hurt, but to wake you up. A lot of times people have this mutually dysfunctional relationship with their doctor. Their doctor gives them bad advice and they continue going back to their doctor. So Nelly, if your doctor is only wanting to up the meds, then find another doctor. You're not bound to go to that same doctor. So there's this place where we, as humans, as people, if we have pain in our body, we have to start taking ownership of what's going on with it. And if you don't, then whatever happens to your knee, you end up being a victim of. And understand that is a choice. And I will stop there. Okay, let's see. Is arthritis normal after multiple fractures of tibial plateau? Normal? Did I always have arthritis of the knees? I wouldn't know how to answer that question. I will tell you that arthritis develops as a result of the joint being dehydrated. Think about that one. All diagnoses of arthritis across the board is dehydrated joint, which means the joint itself doesn't have enough water or lubrication in it. Let that sink in for a second. Drinking water is not enough. Getting shots in the knee is not enough, because it's a pattern that's going on in neurology where the joint has been compromised and it's collapsed on itself. That doesn't mean this is how it's supposed to be. Some people's joints collapse easier than others. Some people have other tension patterns going on in their body that affects the integrity of the knee joint differently than others. So what is normal for one person may not be normal for another person. So normal isn't a really great way to ask the question. The question is, what can I do to relax the tension in the knee joint to create the space so when I do drink water, it can get back into the joint and the body can begin to lubricate the joint on itself so the joint isn't so achy and stiff, which is the definition of arthritis. How's that? Finding lifting of knee from can exercise difficult. Okay, let's see. Okay, Jane, everybody, go to my website, take my 7-day knee pain reduction challenge, take the assessment, get in there. I demonstrate how to begin to get relief in your knee. If you get relief, if you notice a change in your neurology, which can be a whole host of other things, the goal of that 7-day challenge is not to completely get you out of knee pain, but it's to give you a sample of what I'm talking about and what I'm offering, because otherwise it's all in theory. Go there and do that. If you notice a change, get into one of my programs. How about that? Christine, postponing surgery. I want you to I want you to slow down, because a lot of times people with knee pain make emotional decisions. And you can be excited about what I have to say and all of that, which is great. But I want you to have a strategy other than just postponing the surgery. Begin to do things. Get like the next 3 steps in place so you have a strategy. Because what ends up happening is if If we tear weeds out of our garden and don't plant anything in its place, the weeds are going to grow back up. That's the reality. So if we're not going to do the surgery, we have to replace it with a better strategy so the knee can heal itself. Okay, let's see. Fascia, you really know what you're talking about. I know what I'm talking about that's different than what the doctors and physical therapists are talking about. Okay, let's see. Yes, thanks. With natural loose ligaments in my mid-40s, I feel my knee misalignment issues stem from years of internal stress affecting my fascia. Yes. And just to be clear, there is a strategy. Just like baking a cake, there is the right ingredients in the right amounts, in the right order, with the right timing in order to bake a cake. And the same thing with getting out of knee pain. You have specific things we need to do. If you have loose ligaments that are causing the pain, first we need to develop the skill on how to get the pressure off of the nerve so you feel relief first. Then we got to set up the conditions in your body that supports your body holding on to comfort as long as possible. Water, nutrition, breathing, stretching, exercise. All of those things are there. And then third step is we need to make sure your mindset's in a good place. We need to strengthen those loose ligaments to hold the knee in a new good place so it isn't going to be sloppy and sliding around and causing pain again. So there's a system to it.
Only you understand how I'm feeling. Yeah. And I know I can tell you anything. You won't judge, you're just listening. Yeah.
Okay. How about that? Sorry about that. It's like something weird with the technology. The phone rings. Well, as video starts playing. Okay. That's what we got. Ann, I like your approach. Thank you. Jane, thank you. 7-day challenge. We'll check it out. Great. Yep, I have second opinion scheduled for the same day. I understand. I'll stick with your program. Great. And yeah, believe me, life's adventurous like that. Ever since I dislocated my left knee, I just can't take life that serious anymore. It can be rather amusing at times. Okay. For those, and if you're going to go over to my website, take my 7-day challenge, there's a program called the Comfort Zone that we are having our monthly membership call on Thursday. You could sign up for that if you sign up for that program. The other coaching programs have multiple calls, or the group coaching program has multiple calls this week, one this afternoon. That's the Quit Your Quack program. Anyhow, I am going to, let me double check what time it is. I got to scoot. I need to work with some friends. Nellie, I was told when I was 8, I had growing pains. I'm 44 and I'm still in pain. Yeah, Nellie, it's just because to leave the docs and physical therapists off the hook, they just don't know this. They really just don't know this. They don't look at the body on a deep enough level of the neurology, of what's causing the pain patterns in the body to tense up to protect itself. So go take the 7-day challenge. That's your next step. And I get into one of the programs on the other side of that. It's very deep. There's a lot to it. I'm not going to be able to compress it all into one, what was it, half an hour video today, but there's a lot to it. And if you stick with it and you trust in the fact that if you create comfort, it's going to illuminate a path for you to get out of pain, then no matter what you're dealing with, we can reduce the pain, if not eliminate it. I got to scoot. I got a call here I got to get on. Thank you so much. If you like the video, give it a thumbs up. Like and subscribe to my channel, The Knee Pain Guru. Turn on notifications so you're aware of future videos. Go take the 7-day challenge, and I will see you on the next video. Next one's Thursday, 9:55 a.m. Have a good one.